Thank you for the excellent presentation, Naila and Christina. Really loved listening to you. We have started receiving questions in the chat section, but I can also request them, Fiona and Della, if you would like to unmute yourself and ask. I think these are very relevant questions. And also, starting us off, we expect more questions. Fiona, would you like to unmute yourself?
Sure.
Yeah.
Thanks a lot, team, for this super insightful presentation. And I'm very keen to learn a bit more about how we can how we can improve the coding system of our current coding systems of the CBA database, but also for the future, right? So if you so I have basically two questions in one. One is, do you have recommendations on how we can better capture all the topics on nutrition in CBAs that might be there now, but that we haven't captured because of the way that we interpret it, right? So that's question number one. And then the other question is linked to that in terms of for when the keywords were not there. Is that because you think they were not mentioned in the CBAs, or because the coding system is not up to date with that? So that's, yeah. So like, how do we improve it? Also, as such that people know how to use these type of words when they want to negotiate on this topic more, right, in the future, like what was just shared in the recommendations.
Yeah, thank you, Fiona, for your questions. I think it's a really good question. So, for the wage indicator, it is a pre-coded variables. So they already have a listed of variables that they coded, but unfortunately, not every pillars of our for workforce nutrition is available explicitly. So for example, like nutrition here, if you see like nutrition, balanced meal, and balanced diet, it's not available in the wage indicator variables, but we can find another related keywords such as meal allowance, but it is not direct nutrition reference. So that's the difference. So I think like yeah, to really improve like for the recommendation to really improve like how we better capture nutrition among CBAs for specifically for the database, I think it's also to expand the keywords that or like the coding that related to nutrition itself. And so for the difference between the wage indicator, Leggy France, and US OPM, it is located because wage indicator is pre-coded variable analysis. So they basically already read through and annotate everything. But for the Leggy France and US OPM, we relied to the keyword search. So we pre-identified the keywords that are related to each pillars, both the direct and indirect. And we check whether there is CBAs that mention specific keywords for each. So for example, here, like in nutrition, in balanced meal and balanced diet, no CBAs in US OPM database that mention balanced meal and balanced diet. They probably mention it without us knowing because maybe they use another terms or keywords, but we cannot 100% sure about how they integrated it because we solely base on the keyword search. So that's one of our limitations for the study. And also for the breastfeeding break paid, for example, we cannot see whether it is already integrated or not in Leggy France and US OPM again because of the keyword search. In Leggy France itself, I think it is more than 20,000 CBAs there. So within like the limited time, we cannot really read through everything and check whether they mention about breastfeeding break paid. So we don't use that, but I think it is a recommendation for future research to maximize it. Yeah, I hope it's answering. Or if there's any feedback, Fiona?
No, great. I was saying in the chat that it's for now a limitation of the study, but an opportunity for us to improve the coding.
Yeah. Yes. Thank you.
Thanks.
I think,
we have
Lina, sorry to jump in, just to add to what Naila has mentioned. I think we on the Workforce Nutrition Alliance's website, we have already have like the pillars. We have the key terms that Wage Indicator can look at, and if they want to, they can focus on integrating the keywords from there to pre-code. Yeah. But the website is up and running for you to have access to the frameworks that guides our implementation.
Thank you. And I think these are helpful in the sense while we are coding, right? It's always good to hear different perspectives in terms of understanding what are the keywords that we should look for. Even what you bring out in the paper is like a 0-1 mention of just saying they had meals, or what were they saying about meals other than the fact that people should have meals? Even then, they're coded as one, right? Saying, okay, they mentioned meals. So I think these intricacies really get into play. But I have a question here from Della, and then there are more questions, which is great. Della, would you like to unmute yourself?
Yes, Lena, thank you. Hello, I'm Della from WageIndicator in Indonesia. Like my chat, yeah, I think it's fruitful finding from Gain because I'm here with the annotator of the CBA in Indonesia. Here, Andina. In chat, Andina also said that when Lina asked us, how about the CBA on nutrition in Indonesia? We only can find about the clause on extra fooding while overtime. So we don't think that like what Gain give us today about the indirect meal. Yeah, yeah, for me it's another view that open up our mind. And I would like to know, uh, it is about the occupational safety and health from Gain perspective. Is it also it can be included in indirect nutrition reference? This questions just came up to me while I'm thinking about the crossing, about the health educational, about the health checks. So many, it is especially after COVID, many CBAs in Indonesia, there is a clause on medical checkup, MCU. So yeah, so they always, and we annotate it as the part uh, of the occupational safety and health, but I think it can be also we can see it as uh, indirect nutrition reference. But I don't know. What about this from Gen perspective? Thank you.
Yeah, I think it's really good findings that after COVID, it is increasing like the awareness to include like the medical checkups. I think it's also aligned with our interest research as well, because actually like for the nutrition focused health check, uh, is include medical checkup is also included. But why we put it like indirect nutrition related provisions is also because health check doesn't mean that it is related to nutrition. It could be like related to health, but not specifically to nutrition. That's why we put it on the indirect one. But if the health check maybe included some of the indicators or biomarkers that are related to nutrition, such as like diabetes, that is very related to nutrition, right? Because of the sugar consumptions and something like that. So that's why like we differentiate between the direct and the indirect one. But I think it is, I mean, if we want, if you want to expand it a little bit more and more specifically to nutrition, I think what will be helpful is we differentiate it that way. So we differentiate so the direct one is the one that is really related to nutrition, such as like I said before, like maybe something related to diabetes or like blood cholesterol level or biomarkers that are related to nutrition. But for the indirect one, health check and medical checkup, it's also included. So yeah, I think that's yeah, that's what I can reply to that. Is there any addition maybe from Christina or Chioma? Or if there's any feedback from Della?
Yeah, I would just agree with you. I mean, I think, and you're closer to the coding, Nyla, and I think a number of people on this call. It doesn't strike me that that any of the coding is the problem, right? I think the problem here is that it's not recognized. Nutrition is not really recognized as an issue in and of itself. So there's any references that are related tend to be mostly indirect, because things like meals, maternity leave we know is mandated, right, in a lot of countries. So that is a negotiated topic. But things like meals are important for workers because they're a benefit. They're often like, like almost an addition to a wage. But they're appreciated because of, it's kind of, it's because it's caloric and filling, and it's important for people, especially low wage workers, to fill their bellies and feel like they're not suffering from hunger, but actually it's nutrition and the quality of those meals that we're really most concerned about. And those don't seem to arise in any of the CBAs. And we would pose back to you all who work closer in this, like, what can we at GAIN do, and how can you help us raise this topic so that even workers are aware that it's not just a meal, but at the quality of their meal that's really important and most beneficial for them. Thanks.
Very interesting. I'm loving this discussion. I see two questions, and maybe you can just take them. So one is from Gregory, who asks, does GAIN operate in South Africa?
Thanks for the question, Gregory. Unfortunately, we're not in South Africa, but we've been working on workforce programs for about 10 years at GAIN, and we have a lot of kind of collaborations and partners, and we have worked with some companies and through the University of Pretoria in providing support for workforce nutrition. So we don't have a presence there, but certainly partnerships. So please do feel free to reach out if you think that we can kind of find some collaboration or way to support you in your work there. Yeah, thanks.
So Gregory, that's for you. And I think it's good to have webinars like these, right? In the sense we find the other people who are also thinking about this topic in different contexts. There's a question from Kea, and I know you also discussed this in the paper. Do you have keywords in multiple languages? And how did you actually tackle the language barrier, translation, and ensuring that all the words were searched for?
Yeah. Thank you. I think it is important questions. So for the US OPM, we're glad because the local language is English, so we don't need like any translations for that. But we develop for the keywords. We develop it in English. So we have several bunch of keywords that are related to all the pillars, and we conducted it in English. But for Legifrance, because it is with French. So we ask our colleague that's fluent in French to check for the keywords, and also she recommend us the options just in case one keywords is not is not showing like the result. So we have several keywords for a specific language. So I think like to tackle the language barrier, I think basically we ask if we have a colleague that fluent in that language. So for example, in-depth analysis for the CBAs, the qualitative one. So we also ask people from Bangladesh to have it translated. Actually, we already translated using a DeepL. But to dig more like a contextual understanding, we ask people from Bangladesh to really read it through and check whether it is right or wrong, or like our interpretation is right, so something like that. Yeah.
There's also another follow-up question. Kia, may I request you to unmute yourself? And this is also Professor Kia Titans from WageIndicator. You have also referred to her past work on CBS in your paper.
Yeah, can you see me?
Yes, Kia, we can see and hear you.
Okay, yes. Within collective bargaining, there is overall both parties at the bargaining table prefer extra wages over extra meals. So full stop. That that is what it is. So when you search for meals in collective bargaining, it's a picture that is not fully representative because part of it may be reflected by extra wages. That's it, my response.
Yeah. That's really interesting. And from your perspective, I mean, I think that's what we understand as well, is that, you know, at least with where we've been engaged in the garment industry and the tea industry, people do prefer wages, of course, and be able to make their own decisions and have more money in the pocket. But I guess there are industries where meal provision is mandated, right? Because the worker population is either far away from a place where they can access meals, like in mining companies or shipping companies, things like that. And then for sure, because it's also mandated, they will be there and it's not kind of negotiable. But do you have any suggestions for us on how, you know, I don't think we're going to reverse the tide on workers requesting meals if they're nutritious instead of wages. People always prefer wages, but where there is room for improving upon the quality of meals in CBAs. We would really love suggestions. Even, you know, we don't necessarily work directly with kind of legal instruments. So, you know, we're more kind of advocacy and support, but we really, well, we look forward to collaboration and advocacy from you all as well. But please let us know if there's anything that we can do to kind of address this issue of nutrition and how we can kind of improve, I think, worker awareness too around how important it is for them to get not just a meal, but a nutritious meal.
Yeah. Yes, so basically employers in most cases will provide a canteen to the workers. And so in collective bargaining, there could be recommendations or clauses related to healthy food in the canteen. And most CBAs also have clauses in case of overtime work, because then also the employer is requested to provide a meal in between, you know, before overtime work starts. So in all these cases, there could be clauses on not only a meal, but a nutritious meal. So, yeah.
And even where the meal is not provided for free, right? Like more a cafeteria where at least where things are offered and workers can purchase it, purchase the food, but that there are healthy food options there.
Yeah, that's for sure. And that could be agreed in collective agreements.
Okay.
Yes.
Great. Thank you.
Yes, Fiona.
Yeah, I have another question, maybe also to the GAIN team on where do you see this conversation headed? For example, with union strategies on this topic, is this a topic and what is the role of GAIN in pushing this topic further also within CBAs, if this is not a topic yet that's taken up by trade unions?
Thanks. Well, I think that's a lot of why we're here in this conversation also, is to get ideas from you. Because to be quite frank, I think we've had the most success working with business associations and from the employer angle, as well as with governments and policies and our engagement with ILO and ministries of labor in countries. But I think where we've had the least success and where it's a little bit less, the entry point is less easy, is through unions and through the worker angle. So yeah, I think, you know, we look forward to your recommendations on how to go about doing that, because it's kind of our next step. And yeah, I think you know, we've worked, I think in Indonesia, we've had some success with some labor unions there, but it's still just beginning. Yeah, Choma, I don't know if you want to add to that.
like, I just want to agree with your point that we are also looking for how or opportunities, how to influence or how to connect more with labor unions, because we have achieved great success in our policy work with the government across different countries. We are in about 12 countries. We have achieved great success there. But the union is somewhere that with your perhaps your insights, we can maybe chart a better way forward.
Thank you. And I think these are all conversation starters, right? These are all deep conversations about the economic trade-offs. Should you pay or should you provide food? And whose problem is it if the workers fall sick? Is it on the employers, and that's why they are more interested in this? And workers want wages because they can make that decision. What does high calorie food mean? Or should you just pay and make them let them make the choices? What are the words that ideally should be included in CBAs, which will finally result in better nutrition and healthier workforce? Or is just the 0 1 variable enough? Right? So these are also in terms of the quality of what is included, what is bargained. Or for example, if it's not bargained and still happening in reality, because these are the areas where they have to provide food, for example, the sectors that you have chosen, and then there is nothing around outside the workplace. So yes, these are super interesting questions, and I hope you continue working and we continue working together to explore these questions in detail. You also write in your paper that about future research possibilities and some of the regression analysis to figure out what is causing inclusion in some areas and what is not. If you have more thoughts, I would love to hear them. And the other one, okay, maybe I'll actually let you answer this one before I move to the other one.
Sorry, can you repeat the question again? I didn't catch
Yes.
the last.
So in your paper, you have mentioned like for future research, we need to move into more regression analysis beyond the binary coding of whether it's present or not. Do you have something specific in your mind?
Yeah, so actually, before the one that we already have, the one that WageIndicator has is actually, did you already provision meal breaks, for example? Yes or no? But we need like the rigorous detail about like, okay, if it's already there, how is it implemented? Is it like already healthy enough or is it not? So that specific, a recommendation that we want to explore more.
Okay, I think so. What you are saying in principle is moving towards the whole statement analysis
Yes.
rather than
Yes.
just saying about the presence.
Yeah.
Kia also has a point on chat, but Christina, yes, over to you.
No, I just wanted to say, I mean, I think if there were more CBAs that included nutrition, then we could do more, I think, with regression analyses and look at like what are the contexts and what are the industries and sectors and countries where it really emerges more, and do a little bit more analysis there. But I think our overall take-home message is it's just not there, right? It's just not there enough. It's very rare. Obviously, there's a lot of room here to improve awareness around nutrition and not just food, and the importance of the distinction there. Yeah.
I
And
agree. Yeah, sorry.
No, go ahead.
I think you also mentioned in your paper, right? So sometimes for overtime clauses, that's where the concept of meals are mentioned, which maybe, I don't know if it's linked to saying food is something you do after work and only if you stay for longer, it's on us, right? So these kind of conversation is always good to know how this conversation started and how it ended. That's a whole research project, I can think. So if you are writing research proposals, please let us know. I think we would love to explore these questions together, right? Because both of us want to know how this is happening. What are the implications, for example, if someone includes canteen, providing vouchers, as you were saying, it can be free, it can be paid, and then who essentially ends up buying, right?
Mm-hmm.
Or if for countries where you want to bring your own tiffin and then you don't want a employer provision of food. So this is something for us. And Kia actually has written on chat that WageIndicator has a series best clauses in CBAs on a specific topic. We could propose for an item in the series regarding healthy food. I agree. And these are all feedback. And I think you also have more clauses on your website, as you said. Overall, it was a very interesting read of your paper, and I really enjoyed listening to you as well. So thank you for being with us. Do we have more questions from the audience? I'll just quickly see.
I just wanted to jump in on one of I know there's a lot of discussion or questions about living wages, and I know that you all do a lot of work with living wages, and just to say that early on, I think through IDH and the anchor methodology for living wages, we were really happy to see that actually the concept of living wages and the calculations include not just, what are the wages that are needed to buy food, but also to buy healthy food. And so that was really nice, at least from Gain's perspective, to see that in kind of the living wage work. Just wanted to make that comment.
Just to say, Christina, I agree. And within WageIndicator's methodology on living wages, we have this too. So we include a healthy diet, or even more so, healthy and nutritious diet, which also includes local specificities on what that is. As such, it is also accessible. So it's a healthy, accessible, and nutritious diet, or accessible, healthy, and nutritious diet, I would say.
Yeah, fantastic. Great.
This only shows that we are all thinking across the same line, and this is for the audience. So the study that they presented today, right? So the scoping term was April to July 2025, and this is July 2026. So we have come like one whole year round. I also want to maybe end with this thing that you said after COVID, health has become more of a focus, and maybe over time you expect CBAs to include more on health checkups. But do you still see inclusion of nutrients or micronutrients in clauses? And just a leaving message on what do you think we all can do together collaboratively to make it happen for a healthier workforce?
Well, maybe I'll just quickly comment on the health checks. I mean, I don't know. This was a one-time deep dive into the CBAs, but maybe if we repeat the study and see if there's been an increase in kind of in a year or two, to see if there's an increase in health checks emerging, that would be really interesting. And I think what we've learned also, at least from the nutrition community post-COVID, is that underlying dietary factors and nutritional status was such an important risk factor for COVID disease progression. We're always surprised that nutrition has not emerged more and more as such an important topic, but we're getting there. And yeah, I love these kind of conversations that we have with folks from different sectors and how we can work together on kind of mutual work. So I think this is just the beginning of conversations. Thank you so much.
I love the fact that we are ending this webinar by saying that this is a beginning of the conversation, and I really hope we keep in touch. So I'm really grateful to the people who have joined our webinar today, and I hope you continue this wonderful work. We have feedback for ourselves in terms of coding. We'll look more into which clauses we can include. And yes, let's also start seeing the changes over time and countries, and if we need a pandemic to really change CBS in this world. Right. So thank you again, everyone, for coming here. If you want, we can click a picture for saying hello to the rest of the world, saying we are having this conversation. Join us. Valeria, do we do this?
Yes.
Okay. So should I maybe unpin ourselves and then have it with the whole team?
Yes, please.
Yeah. Wait, but I think you'll have to unpin me because I can't unpin myself. I can only pin myself. Yes, thanks.
Bye-bye. Thank you. Bye-bye. Thanks.
We'll just click a picture with the team. So if you're comfortable having your video, just have your video on. Okay. Everyone, say cheese. Okay. Thank you so much then, and let's stay in touch.
Thanks, everyone.
Thanks a lot, team.
Thanks a lot.
final thing while we say goodbye, but we're updating our backend system for the CBAs at the moment also, so we can include a lot more of these smaller clauses from France and stuff like that. So ideally, we actually do this research again together in a year or so, and then hopefully we can actually do this analysis for like 30,000 CBAs or something, right?
Great.
40, 50. Let's
Great.
go.
Can I add something still? We're not finished yet, I think. For the data collectors, we can ask many data collectors around the world how they find nutritious food. Because now, so they collect data or prices for, let's say, cheap, super cheap, and more expensive food, but we can ask them how they find it. Because that is, let's say, the proof in the pudding is the eating. So such an interview with a couple of data collectors would be good. And I think, where was Guide? He was here still. So
He left.
I will ask.
Yes. I think there's a lot of scope to do. And I also figure clauses like breastfeeding and parental leave come more often because these are some things that people think about. Nutrition, micronutrients are actually sometimes cognitively harder to think about in reality, like what it means, what to write, how to bargain.
Exactly.
Could be a reason why it's not specified, right? Because these are harder things to think.
Yeah.
Okay, then let's continue this research and let's have a
Yes.
webinar again in 1 year's time.
Thanks, everyone.
Thank you so much.
Thank you.
Bye-bye.
Thanks, everybody. Have a good day. Bye-bye.
Bye.